want to get back to one thing, because you, from private cloud, you went into hyper-converged route, which I found interesting. And I came to you and said, hey, no more than 2 racks in every hospital. And I know when I said that to the team, they sort of were incredulous. And I think some of our listeners from health systems are saying, there's no way our health system in that hospital could get down to that number. But talk a little bit about what hyperconvergence was able to do at the hospital level for us.
So all hypercompute is really condensed compute and storage memory power, right? So most applications that exist nowadays are nowhere near the level that you could provide, in basically what I could fit under a desk right now. So when we started getting into the applications, and we knew there was these are my toys element to the local staff too. So being able to come in and say, we're not going to take your toys out of there. What we're going to do is just put them in a new case. But that new case now is a fraction of the size, right? So this is kind of just the convergence of data and compute. So we found almost immediately that, about 6 U's, which is roughly, 6 to 12 inches of space, could hold hundreds of servers of what you currently have. So getting to that point was extremely easy. And it also kind of won us a lot of different confidences too, by saying we're not moving it out. And once it was in the hyperconverged, our ability to migrate out into the cloud for the DR stuff was almost push button easy.
Yeah, absolutely. And then you can go to third parties and be able to migrate out, migrate in as needed. So yeah, you were able to get down to, in a lot of our hospitals, you were able to get down to a half rack. I think the largest was maybe 2 racks. I know you always argued with me on that, but essentially self-contained racks, you didn't have to have a specialty room. You can move that stuff around, and I think that has some DR benefits for it. The other thing is people always ask me, if you're moving this stuff into the cloud, what happens in the case of disaster? So if your connection to the cloud goes, what do you do in that case? And so one of the more ingenious things I think that you and your team came up with was almost a reverse DR process, which is our primary was in the cloud, but we were actually trickling data back down into the local data center, so that if something went down on the network, let's say there was an earthquake in Southern California, the network went down, those hospitals would still be able to run certain core systems because we had trickled the data back. So it was almost a reverse DR kind of thing.